Vitamin D and autoimmune diseases. Vitamin D has long been recognized for its important role in maintaining bone health and regulating blood calcium levels. However, recent studies have opened a new direction in medicine, especially in the treatment of autoimmune diseases, thanks to the broad impact of vitamin D on the immune system. One of the pioneers in this field is Dr. Cícero Coimbra, a neurologist from Brazil. He developed the Coimbra Protocol, a treatment method that uses high doses of vitamin D3 to help bring autoimmune diseases into remission. The initial discovery happened by chance about 25 years ago when Dr. Coimbra treated a Parkinson's patient with a dose of 10,000 international units, IU, of vitamin D per day to support nerve function. Surprisingly, he noticed that the vitiligo lesions on the patient's forehead nearly disappeared after some time. This led him to question whether vitamin D could play a larger role in regulating the immune system and preventing autoimmune disorders. From then on, he and his team began conducting deeper research and adjusting vitamin D doses for autoimmune patients, while closely monitoring to avoid calcium overdose toxicity. They found that when patients limited their intake of dairy products, a major source of calcium, the use of high doses of vitamin D became safer. This paved the way for a natural, cost-effective treatment method with fewer side effects compared to conventional immunosuppressive drugs. A key highlight in Dr. Coimbra's discovery is the irreplaceable role of vitamin D in the immune system, far beyond its traditional role in bone metabolism. This discovery is changing the approach to treating many chronic diseases, especially autoimmune diseases such as multiple sclerosis, MS, rheumatoid arthritis, systemic lupus erythematosus, and many others. High doses of vitamin D. Why are they necessary? One of the common questions when mentioning the Coimbra Protocol is, why is such a high dose of vitamin D necessary? The answer lies in the genetic differences and the vitamin D absorption function of each individual. According to Dr. Cícero Coimbra, many autoimmune patients have genetic variants, polymorphisms, that affect the metabolism and utilization of vitamin D in the body. There are up to 9 different genes involved in the effective functioning of vitamin D, and even if one or a few of these genes are faulty, the patient may not absorb or utilize vitamin D properly. This is why blood tests may show normal vitamin D levels, but in reality, their immune system is still lacking the necessary active compound to regulate properly. For healthy individuals, a typical dose of 600 to 2,000 IU per day may be sufficient. But for autoimmune patients with vitamin D resistance, Dr. Coimbra recommends an average dose of 1,000 IU per kilogram of body weight per day. For example, a person weighing 70 kilograms may need up to 70,000 IU per day. In emergency situations, such as before surgery or when rapid vitamin D levels in the blood are needed, a dose of 600,000 IU may be used in a single dose, sometimes repeated 1 to 2 times under strict medical supervision. However, using high doses of vitamin D always comes with risks if not properly controlled. Vitamin D increases calcium absorption from food, so if calcium intake is too high, such as from milk or cheese, it can cause hypercalcemia, leading to fatigue, nausea, or kidney stones. Therefore, a diet restricting dairy and calcium-rich products is mandatory in this protocol. Thanks to these adjustments, patients using the Coimbra Protocol not only ensure safety, but also achieve high effectiveness in stabilizing and remitting autoimmune diseases, something modern medicine has been struggling to find a comprehensive solution for: absorption and support factors. When it comes to vitamin D, many people only think about its role in enhancing calcium absorption and protecting bones. However, the reality shows that vitamin D is a multifunctional hormone affecting nearly every organ system in the body, particularly the immune and nervous systems. One of the key factors affecting the effectiveness of vitamin D in the body is magnesium, a mineral often overlooked but plays a foundational role. According to Dr. Cícero Coimbra, magnesium deficiency could be one of the main reasons why patients do not respond well to vitamin D therapy, even when taking high doses. Magnesium participates in the activation process of vitamin D, helping to convert it from its stored form into its active form that can interact with receptors in the cells. Without sufficient magnesium, the body becomes vitamin D resistant, meaning it cannot utilize it effectively even if blood levels appear normal. Therefore, in the treatment protocol, doctors often recommend supplementing magnesium alongside to ensure overall effectiveness. A groundbreaking discovery in vitamin D research is that vitamin D receptors, VDR, are present on almost all cell types in the body, not just limited to bones or intestines as previously thought. Since 1988, scientists have demonstrated that the immune system, brain, cardiovascular system, pancreas, and even skin cells have the ability to directly interact with vitamin D. This helps explain why optimizing vitamin D can have a positive impact on many chronic diseases, including autoimmune disorders, depression, diabetes, and neurodegenerative diseases. In conclusion, to maximize the benefits of vitamin D in treatment, especially for those with autoimmune disorders, attention should not only be given to dosing, but also to support factors for absorption, with magnesium playing an essential and irreplaceable role. Vaccines, aluminum, and autism. One of the most controversial topics in modern medicine is the connection between vaccines, aluminum, and neurodevelopmental disorders, especially autism. While the majority of the medical community still asserts that vaccines are safe, some independent studies and clinical experiences of Dr. Cícero Coimbra open up a different perspective, one worth considering seriously. Aluminum is a component often used in vaccines as an adjuvant, which helps to enhance the immune response. However, according to Dr. Coimbra, aluminum is not easily excreted from the body, especially when injected directly into the bloodstream. Instead of being eliminated through the kidneys, aluminum can attach to immune cells, move throughout the body, and penetrate the brain, where it can cause metabolic disturbances and long-lasting neurological damage. A notable study conducted by Professor Christopher Exley in the UK found high levels of nanoaluminum particles in the brain tissue of individuals with autism after their deaths. Under the microscope, they discovered that aluminum accumulates within immune cells and brain cells, leading many scientists to question, could autism be an autoimmune disorder combined with aluminum toxicity? Since 2014, Dr. Coimbra has begun applying high-dose vitamin D therapy, combined with silica, a natural compound that has the ability to bind and eliminate aluminum from the body through the urinary tract. He has observed significant improvements in autistic children, children with severe depression, and adolescents at risk of suicide. In one typical case, a girl diagnosed with depression at the age of 4 showed an 85% reduction in symptoms and was able to reduce her antidepressant medication after a year of using silica combined with vitamin D. Although still debated, these findings are opening new directions for screening and treating neurodevelopmental disorders, and once again highlight the crucial role of vitamin D in modern medicine. Doctor training and global application. The Coimbra Protocol, a therapy that uses high doses of vitamin D to treat autoimmune diseases, is not just a personal initiative of Dr. Cícero Coimbra in Brazil. Thanks to the positive results and the significant improvements seen in thousands of patients, this method has spread globally through a system of specialized training for doctors in many countries. Dr. Coimbra and his team have directly trained hundreds of doctors from the United States, Germany, France, Italy, and many other countries. These training sessions not only impart theoretical knowledge, but also provide detailed guidance on monitoring processes, adjusting vitamin D doses, managing the risk of hypercalcemia, and especially advising on nutrition throughout the treatment process. Doctors who are trained must strictly adhere to the protocol's principles, including conducting regular tests, advising patients to reduce calcium intake, supplementing magnesium, and other essential micronutrients to ensure optimal and long-term safety and effectiveness. If you are looking for a doctor certified in the Coimbra Protocol, there is now an official list available on Dr. Coimbra's website. Here, you can search for doctors by country, region, and even language, making it easier for international patients to access this treatment method officially and with clear medical guidance. The expansion of the Coimbra Protocol Doctor Network not only helps spread this groundbreaking treatment solution to more patients, but also contributes to changing the perception of the role of vitamin D in modern medicine. Instead of just being seen as a supplement for bones, many experts now recognize it as a powerful immune regulating tool, particularly useful in chronic and autoimmune diseases.